we're moving on to another. I hate to call it a tragic story, but it is a tragic story unfolding, and it's a slightly a different topic around healthcare in this city. Unity Healthcare. I'm glad to introduce, and he will be on again another time with us, Carey Lane, who is a union organizer grappling with the mounting crisis. I'm calling it a crisis at Unity Healthcare. He's working with the workers there. He's going to tell us what some of the problems are. But I would just like to say, for those of you who do not know what Unity Healthcare is, some of you may have heard of DC General, which the powers that be worked for years to make sure that our only public hospital was closed. And my friend Lucy was right there out in the streets with us as we try to keep it open. In the process of closing DC General, they also shut down around 15 or 20 community health clinics that were under the umbrella of the public health system. And out of that, there was an organization called the DC Primary Care Association, and
this is a clear case of privatization.
Yes.
Because all of the clinics and the hospital were under D.C. government. And we know that all across the country, government services have been privatized. They get rid of the black employees, and they give contracts to nonprofit organizations, which tend to be headed by white individuals.
And they turn into capitalist organizations.
And they hire young white people who don't stay very long, and so there's a lot of staff turnover.
Yeah. And so, Lucy, check this out, what we're going to hear. It's quite upsetting, and we're all going to need to support and stop what's happening. Carey Lane, welcome. Welcome to WPFW.
Well, thank you so much, Joni. Thank you so much for having me and alerting your listeners to this very alarming situation.
Yes. So first of all, tell us about the union that you represent.
Okay, we're the Union of American Physicians and Dentists, UAPD. We're the oldest union who have organized physicians and healthcare providers. We've been doing this for 52 years, mostly on the West Coast. But we're seeing a lot of demand and more demand for unionization of healthcare providers than we can handle. So we have moved steadily into the East Coast, and Unity Healthcare is one of our first units on the East Coast.
So tell us, because we unfortunately have not that much time, but tell us what's happening at Unity. I've been very familiar with Unity for decades, for 4 years. I used to be on the board of their Healthcare for the Homeless program, and it's quite tragic and alarming what is happening. So.
Yeah. So, after years and years of unsafe working conditions and a culture of bullying and intimidation and corporatization, as you mentioned, we had, a revolving door, as you mentioned, of overpaid executives and lack of transparency and lack of giving these vital healthcare providers breaks or administrative time, and retaliating and withholding their pay. The 150 Unity providers who consist of, not just physicians, but nurse practitioners and dentists and midwives and mental health clinicians. They organized with us in the fall. They won their union election in December with a 90% vote. And I don't need to tell you how significant that number is, and,
wow.
and sort of symbolic of the workplace issues we're seeing at Unity. But Unity providers see 80,000 patients across all wards of the city, through 20 clinics, of course, through the DC jail and through homeless outreach. But this continued disrespect of these workers and the corporatization of this federally qualified health clinics has created a very alarming situation. So
Carey, let's just start out with, how many clinics does Unity have at this point? Is it still about 20?
Yes, about 20. and plus the DC jail, and they also do homeless outreach. So they're working with the city's homeless population, the poor, the disadvantaged, really providing frontline care for those who cannot afford health care otherwise. It's such an essential service. And we're really flummoxed, and the public should be alarmed that these essential providers are in a workplace that is so unsupportive and in fact draconian. The CEO has a consulting background. I don't think a consulting background or a corporate background really sort of should be in leadership for a federally qualified health clinic that provides services like these. It's sort of antithetical to the mission of what
Absolutely.
Unity does.
Mm-hmm.
We because of the union victory, we get to collectively bargain our first contract. Thus far, Unity has, first of all, they hired, of course, famous anti-union lawyers, Littler. They have responded basically with delayed negotiations and retaliation through withheld pay and refusal to improve safety measures and attempts to silence our voices through conflict of interest policies and policies that are meant to gag our unit members. But we will not be silent. This is a community issue. And Unity's disrespect of Unity's providers is certainly bad for patients and it's bad for Washington. I should mention that we did file unfair labor practice charges against Unity Healthcare for bargaining in bad faith and retaliation and trying to illegally silence our workers through things like non-disparagement clauses, which are not legal.
So Carey, let me just say, folks, this is a very serious issue. I can't. We're going to have to come back to it, and Lucy, I'm going to have to ask you to help. We're going to have to organize the community to be aware of this, because as people may know, if you are on Medicaid, you now have to go through a very corporate Medicare managed care organization to get your care. Some of that is done through Unity, and I have friends who who thanks to Unity are able to get some health care. It's very serious that with our healthcare issues in the district, they're getting worse, folks, and we know that they're not getting better. And so we're having an attack. A very important entity, Unity Healthcare, is getting worse and worse and worse. How many employees have left already, Carey?
So in the last 3 months alone, we've lost 25 healthcare providers at Unity, which is about 18% of the workforce in the last 3 months alone because of the workplace conditions. They've resigned. And they, for the most part, they have not been replaced. So, it's a very, very cynical situation where the executive team might be looking to pad their numbers by not replacing providers or sending a message that to thin out the herd, to demoralize workers. But we're not demoralized. In fact, we're taking our message to the community in a very big way. We've met with the DC Council.
Met the DC Council. We're gonna have to help you meet with them a little bit more again, because this is a pretty tough crisis, folks. I must say, you are holding a demonstration. Tell us about what's happening on Saturday, and then unfortunately we're going to be out of time. We have 1 minute.
Wonderful, and I want to just invite all of your listeners. We're having a solidarity rally at the Upper Cardozo Health Clinic this Saturday from 10 a.m. to 12 noon. This Saturday, May 11th, Upper Cardozo Health Clinic, as you know, Joni, symbolically...
it's the first health clinic in the United States, first federal clinic in the United States. So
we chose that as a symbolic site for our solidarity rally. It's 3020 14th Street Northwest, Upper Cardozo Health Clinic.
Yes, we know where it is.
Any and all of your listeners are welcome to join us in solidarity. We're going to get, this begins our process of taking our message to the community. We're going to get loud. we are going to get a contract for these essential workers, and we can't thank you enough for helping us spread the message, Joni.
Well, we can't thank you enough for standing up for the workers and for the people. I don't know if this makes sense. If people want to get in touch with you to support you.
Sure. I think maybe the easiest way is through our Instagram page, uapd.uhc. uapd.uhc is searchable through Instagram, and where we have updated information.
And we're going to have you back again, and Lucy's going to help me. We're going to have to try to organize a group of people.
What time is it again on Saturday?
10 a.m. at 10 a.m. to noon at Upper Cardozo,
which is 14th Street between Irving and Columbia Road. It's right next to the Columbia Heights Metro Station.
That's right. It's right there, folks. So if you can come out Saturday morning, and we're going to, again, continue to work with Carey and the union that is supporting the workers at Unity Healthcare. We cannot afford to lose Unity Healthcare, which has 20 clinics across the city, not to mention the jail and out in the streets with the homeless. Thank you, Carey, very much for what you are doing.